And we said the macro is dealing with the national and a more broad perspective, but the micro is dealing with individuals and households. We are having a subsection of the nation or a bigger community. And economics has to do with planning resources, scarce resources, so that they're able to meet all the desired requirements that are required from these economic resources. We also talked about branches of nutrition economics, and we said we had food economics, which is the study of the supply and demand of food, the various factors that affect food prices and the availability and the role of markets and policies in influencing food security and nutrition. And then we also looked at health economics, which deals with the allocation of resources for health care and the determinants, consequences of health behaviors and their outcomes, and then also evaluation of health intervention programs. We went ahead and looked at global nutrition challenges. Global challenges to do with nutrition, and we saw calorie deficit diets. We said that around 800 million people are actually suffering from a calorie deficient diet daily. And that is according to a UN report that was released in 2022. We also looked at micronutrient deficiencies resulting in hidden hunger, consumption of a diet that is low in the micronutrients, leading to a deficiency that usually manifests with time. And these symptoms will always be inherent in the body, but they will not be visible to the individual until it reaches a severe state. And then we looked at stunting, whereby we are characterizing the height for age. And for a child to be stunted, they should be below the World Health Organization standards. And this is a sign of long-term and chronic malnutrition. Overweight and obesity, which is a major concern in the developed world. And we are seeing a shift. You find that in the underdeveloped countries, people are suffering more from undernutrition in form of stunting and wasting and micronutrient deficiencies. And in the developed world, we are seeing more of overweight and obesity cases rising up due to the kind of diets that people consume. Low birth weight. This is a major concern for developing countries. You find that the pregnant women are not having a sufficient diet to nourish the growing fetus. And this will manifest in a child that is that has undergone intrauterine growth retardation, leading to low birth weight. And this low birth weight is going to increase the infant mortality rate. Infant mortality rate is the number of infants that die before the age of 1. And we also looked at global malnutrition. Malnutrition is a big challenge globally, and we have seen the trends whereby we are having more of undernutrition in the underdeveloped countries and overnutrition in the well-developed countries. And this brings us to the concept of the double burden of malnutrition. When we talk of a double burden of malnutrition, we are looking at a situation in a country whereby we are having both extremes of malnutrition, manifesting in undernutrition and also overnutrition. And this kind of double burden of malnutrition usually starts from childhood. You find that a child is born underweight or low birth weight. This child, in the first few years of life, the first 1,000 days of life, we say this is a critical period of growth during which adequate nourishment and proper nutrition is required in order to achieve the required growth standards. So if a child under 2 years has not been given enough nutrition and suffers undernutrition in form of stunting or wasting, and even micronutrient deficiencies. This child is going to grow up into malnourished adults, undernourished. And you find that by the time they are ready for marriage and childbirth, they'll get pregnant, and they also have improper nutrition. So they are not feeding well. And the result is they will give birth to children that are also undernourished. But this woman who has been undernourished and has given birth to a child that is also undernourished, since at adulthood, usually find that some of these people or these children that have experienced undernutrition, when they grow, they may have the chance to catch up and get the required resources to take care of themselves. So what will happen is that because the body has been used to a state of lack, once suddenly there is an excess of nutrients in the body, this person is going to gain weight rapidly. So you find that such are the same people that will, in the later stages of life, suffer from overweight and obesity. So this transition of the same individuals who are undernourished to individuals that are now older age and maybe elderly that are now overweight and obese, this is what we are calling the double burden of malnutrition. You find that the country has to invest resources in treating and taking care of the undernourished. At the same time, they are also investing resources in taking care of those that are overweight and obese. So overweight and undernutrition can coexist in countries, leading to a double burden of malnutrition. And we are seeing some countries and continents that are more affected, such as the Middle East, North Africa, and Latin America. They have high rates of overweight, and overweight rates among children in developing countries, especially in the higher income groups, are also increasing, while the underweight is being manifested more in the underdeveloped countries. So this is what we call the double burden of malnutrition, and it is a major influencer of economic resource distribution for nutrition and health. You find that a lot of resources have to be invested into the treatment of undernutrition and overnutrition. And this is going to limit resources that would have gone to other sectors such as education, such as agriculture, and also maybe political development in the country. And there are also some emerging challenges, such as climate change. This is something that we have all seen, and it is affecting almost every country globally. You find that we are having a rapid shift in the climatic conditions. A country that used to experience equal seasons of rain and sunshine, you find that right now there are extreme periods of sunshine and extreme periods of rain. During too much rain, you see a lot of flooding happening, homes are being destroyed, crops are destroyed. And also during the dry season, you see a lot of drying up of crops and wilting, and we see a lot of famine and lack. So climate change is a very major emerging challenge that is affecting food resource distribution. Food consumption patterns are also shifting, and the role of the private sector. These are major challenges. Behavior changes in eating habits and food labeling have also become very important considerations. When we see such a kind of trend, we realize that we have to invest more in sensitizing communities to have a change in their behaviors regarding consumption of certain foods. The little resource that is there, how can they be able to use it in order to achieve good health and nutrition? And what is the importance of reading food labels? It's very important for you to read food labels because it will tell you, a food label will give you a description of all the nutrients that are present in a processed food product. And once you are able to know what is present in that food product, you can now discern, should I buy it or not? If it is rich in micronutrients such as vitamins and minerals, I realized that it is a good product that could help my children to thrive and become more healthy. So I'll consider buying it. But if it is more rich in fats and calories and less rich in other nutrients, I would consider not buying it because I'm buying empty calories, which I'll feed my children, but eventually they'll still suffer malnutrition resulting from micronutrient deficiencies. And they are also going to experience a state of unnecessary weight gain that is also unhealthy. You find somebody gaining a lot of weight, but is also suffering from hidden hunger. So these are things we would like to also mitigate by changing behaviors and also reading food labels. What are the research gaps that we can find when we think of this? Research priorities can include understanding the role of nutrition in health, in food access, and also utilization. As a nutritionist, as a student that has had concepts of nutrition economics, how do you think you can come up with research topics that will help you to find out maybe the challenges that are facing the communities in terms of nutrition, or maybe the role of nutrition in securing better health outcomes? How about food access? You could think of a community in your country that is undergoing major food shortages. Go onto the ground and try to research what is causing this food shortage. What can be done in order to bridge the gap in this food shortage? And then you can be able to advocate for better policies and better resource allocation in the country. Analyzing the effects of policy-induced food system changes and promoting healthy eating habits. This is also a very important topic that you can look at, a very important aspect also when it comes to our national situation. Enhancing data systems, analytical methods, and capacity for evidence-based interventions. These are all research gaps that we feel someone can venture into and come up with a very good topic and discover a lot of issues that can be dealt with. So let's go further and look at the economic drivers of malnutrition. Malnutrition economic drivers, these are like, what are those issues that are leading to malnutrition? What are the economic issues that lead to malnutrition in a community or in a country? And one of the major drivers that we are seeing here is poverty. This is a primary driver of malnutrition. We see low-income households often cannot afford nutritious foods. This is very practical. A community or a home that does not have, you find that a home that barely has even $1 to survive on a day. So it becomes a very big problem for this family to be able to purchase food that can feed the whole family. And you find that some of the children will be neglected and others will be prioritized. And this is going to lead to more poor outcomes of nutrition in all the members of the household, from the young children to the mothers who will become pregnant and have give birth to other children that will also be malnourished. And also when these mothers grow older, you find that the elderly community is also going to experience the same malnutrition. We also have food prices. Food prices are a major determinant of what people eat in a community. High prices of nutritious foods often push individuals to purchase cheaper and less healthy food items. And volatility of food prices can disrupt access to affordable and healthy food. This is very, very practical in our context in South Sudan. We are seeing fluctuation of food prices. And you find that it is prolonged over a long period of time, prices remain very high. And we see a lot of individuals who cannot even afford to have a 10,000 SSP a day, struggling to actually go to the market and pick out what to buy. Maybe a husband gives the wife 5,000 SSP to go to the market and purchase food for the day. What do you think she can buy with such amount of money? It's very hard. Even vegetables that are even grown in the country and would be cheaper, the ones who are growing, because the prices are high, they need to get something higher from them. So they are going to put the prices up, and this is going to affect every good in the market. The rate of the dollar determining every price of every item in the market. So food prices can lead to malnutrition in various ways, as stated. Food insecurity. Food insecurity can manifest in various forms, in form of insufficient access to food due to economic constraints, and this will lead to undernutrition. It can also result from loss of jobs, income inequality in the country, and also economic crisis. When we look at most of these drivers of malnutrition, the economic drivers, we see that they are very practical to our context and very applicable. Lack of education. When there is limited education, you find that individuals have low ability to make informed nutrition choices. When there's not enough nutrition education and health education in the community, people will have poor health seeking behaviors and poor food choices. So this is going to also lead to higher rates of malnutrition. Unemployment. We know that in Africa mostly, most households depend on jobs to feed the family. If the head of the family has no job, there's going to be reduced household income, and this is going to affect their food purchasing power. And eventually, of course, if you cannot have a 20,000 or more to afford all the food items that could bring you a balanced diet at home, you're going to have to choose less nutritious and inexpensive foods, what you can afford. And you find that sometimes these individuals have saved up something, but once they lose their jobs, they'll have to depend on the little they have saved in order to feed the family. They could think of setting up a business, but you find that economic taxes become also overwhelming for these individuals. Someone sets up a basic business, but they're not able to progress because most of the income is going to taxes. And the little they have goes from hand to mouth. Urbanization. Rapid urbanization also leads to dietary shifts. In most of the urban communities, we see limited access to fresh and affordable produce. Most of the goods are actually processed, and people have a tendency to think that these processed food items are actually better quality foods or maybe high class foods, which is actually a very wrong notion. Food marketing. We are seeing a lot of aggressive marketing of unhealthy foods, and this, of course, influences consumer choices. Most of these food marketing strategies tend to capture the community of the young children. And once the young children and the youth have been attracted to something, it's going to be hard to actually change their mentality, because these young children most of the time will even detect what the parents will buy in the home. If a baby tells you, "Mommy, I don't like greens. Greens are not good. Buy for me noodles. Buy for me potato crisps. Make for me chips and chicken," these children will determine what is going to be consumed in the home. And if these aggressive marketing strategies are not dealt with, we are going to see a lot of poor nutrition outcomes in our communities. So it's also an aspect that we need to advocate seriously for the government to regulate. The economic interests of food industries, you find that they are clashing with the public health goals. The public health goal is to have community that is sufficient and is having good health and nutrition. But the food industries, which are processing most of these goods, they will hinder this progress. Why? Because they are coming up with various products and all they want is their products to be sold. And so they'll come up with these aggressive marketing strategies in order to capture the bigger market. And we also see that the population structure of our countries, or most African countries, is consisting of more of the young children and the youth than the adults and the elderly. Globalization also has extensive effects on nutrition. The global trade can affect the local food systems and access to nutritious foods. And we find that economic policies will tend to favor the export of these cash crops over the stable foods. Income inequality. High income inequality within a society can also lead to malnutrition. We find that the wealthier individuals have better access to nutritious diets. Because they have the income, they can afford these goods. And so they will have better nutrition outcomes. But the low income and maybe the poorer communities are going to have a challenge of limited resources to afford the better and nutritious foods, leading to increased malnutrition and undernutrition, especially in that context. Healthcare costs. We are seeing a lot of resources being reverted to treatment of some severe acute malnutrition in our country. And also, a lot of resources are being allocated into trying to manage and preventing malnutrition. So the malnutrition-related health issues increase healthcare costs, and individuals may delay seeking care due to financial constraints. We are seeing that 3/4 of all our nutrition programs are being managed by the humanitarian sector, and the government is doing little or nothing actually about the nutrition situation. Little is being done. And so most of these families that undergo this malnutrition, you find that a mother is seated at home with a child that has a mark less than 8. Just imagine that. And when health workers go to the community to assess, they ask, why is it that you're seated at home with a baby that is this sick? I don't have the resources. I don't have any money to take me to the hospital. Just imagine. I barely have anything to even eat at home here. These are complaints from these families. So you find with such a kind of economic situation in the country, it's going to be hard to overcome these challenges of malnutrition. Government policies, economic policies such as subsidies and taxation influence food availability and affordability. If the country or the government in a given country cannot come up with ways to subsidize some of the goods, especially the food items, and they instead come up with policies that increase taxes on importation of these healthy food items, or maybe they increase taxes on the sale of these goods, it is going to lead to higher food prices, and it's going to reduce food availability and affordability. And this is going to lead to a bigger problem of malnutrition. So as elites, as people that have studied, when we go out there and become leaders in our government or anywhere, we need to think about ways of coming up with better government policies that will favor the importation and maybe the growth of these nutritious food items, and that will make it easy for the people to access and buy these goods. So these are the major economic drivers of malnutrition. And let's go further and look at the impact of malnutrition. Malnutrition has far-reaching impacts on the economy and also on the various individuals in the population. And we are seeing that malnutrition is resulting mainly from societal underinvestment in its population. We are seeing less resources being allocated to management of undernutrition and overnutrition. And this is going to have an effect on the population of the country, and it will have severe implications for the current and the future population health. Because we have seen that a good nutrition is actually the foundation for good health. So if maybe a child has not had the chance to have proper nutrition for proper growth, this child will grow up into an adult that is actually limited in terms of IQ, in terms of performance, even the human labor workforce. They are not going to perform well. And this is going to affect every other thing in the country, including decision making. Poor nutrition contributes to health disorders like obesity and non-communicable diseases. And this will account for a significant global disease burden and also increased deaths. I would like to expound more on that. When a person is undergoing a situation of undernutrition, undernutrition will come with a lot of effects, such as impaired immune function, poor muscle and bone deposition, reduced cognitive ability, and also developmental problems in children. And this is going to increase the risk of other infections and illnesses, such as malaria, diarrhea, typhoid. Talk of all the other sicknesses that will come out of a compromised immune system. This will cause to increased death among these children, and it will also lead to stunting in those that may survive, delayed sexual development in this population, and also poor health throughout life. So I find that these effects will also impact individuals and the national economies, and this is going to lead to a continuous cycle of poverty in the country. You find more and more people becoming um, poorer and poorer every day. They cannot afford the basic meals. Even in terms of decision making in the government, you find that people cannot come up with good policies. They cannot make good decisions to drive growth in the country. So when looking at the effects of malnutrition, we have to think of the whole structure of the nation. What is the population structure? From young children to the adults, the youth, to the older adults, and also to the elderly. That is in terms of individuals, age group. And then we also have to look at it in terms of the broader economy, the country development sector. How would malnutrition affect? So this is something that is very big, and if you come across such a challenge, you find that you'll have a lot of issues to talk about. Increased mortality rate, economic impact on the national economic growth, reproduction, also the rate of reproduction reduces. You find that most of these children that are malnourished will have poor sexual and reproductive health, and some of them will undergo a state of subfertility, reduced rate of reproduction. Let's look at the global nutrition goals. At the turn of the century, we saw the Millennium Development Goals set up, but not fully achieved. From there, we transitioned to the Sustainable Development Goals that were established to address the global nutrition challenges. And these goals had a lot of aspects to do with food and nutrition, from ensuring zero hunger, better access to food and nutrition, better access to education, trying to prevent gender inequality. What about climatic and resource allocation? All these are aspects of the Sustainable Development Goals. Go further and read about them. But when we read more about these the Sustainable Development Goals, we see more of strategies to actually overcome these economic drivers of malnutrition. So, what are the global nutrition goals for 2025? When the global community realized the serious issue of malnutrition, the United Nations established the nutrition targets for 2025, and commitments from several countries and international donors, for example, Scaling Up Nutrition, have had the same aim to address these goals. And some of the nutrition targets include reducing stunting, reducing the rates of anemia, reducing low birth weight, reducing childhood overweight and obesity, promoting better breastfeeding, and also reducing childhood wasting. All these are targets that aim at reducing the rates of over and undernutrition in the different countries. And most of these targets are actually channeled towards these war-torn countries and nations. Currently, we are seeing a lot of countries undergoing war and conflict. And of course, in every country that is suffering from war and conflict, there is eventually food insecurity and nutrition insecurity because there is reduced agricultural productivity, and people are compromised in a way that they do not have the basic resources to afford nutritious food. And eventually, there's going to be increased rates of malnutrition, especially in form of undernutrition in these countries. So these targets are channeled towards reducing undernutrition in all its manifestations. Monitoring the progress in global nutrition. For us to be able to monitor these targets, it requires robust data systems. We are seeing the role of artificial intelligence in driving better nutrition outcomes. People can now be able to reach even the farthest and the smallest niche in a community in order to assess the situation of nutrition. And with this, we are seeing better tracking and better achievement of these goals. When there is enough data to actually confirm that there is a problem in a community, there is going to be better alignment of policies with that is major issue that is being looked at. And here we are having nutritional objectives. How do we achieve better global nutrition outcomes all over the world? So once we are able to track all the data in every community, we are able to come up with better policies and strategies to mitigate the nutrition challenges. Open data systems. This is also very important for informed decision making. And the countries often lack the resources and capacity for data collection and analysis. So still, with this kind of systems, we are seeing a problem in some countries, such as South Sudan, that actually is struggling with even the basic resources for the nation. Demonstrating the value of data-driven decision-making can also encourage investment in data system. The recent global initiatives. Some of the most recent global initiatives, for example, Secure Nutrition and Scaling Up Nutrition, aim to mobilize resources, share knowledge, and promote nutrition. Particularly, the Scaling Up Nutrition emphasizes country-focused, multi-sectoral approaches and is currently involved in about 57 countries globally. These initiatives play a very critical role in setting up nutrition priorities at the national and international levels. What is the role of the civil society? Civil society organizations, we're seeing a lot of NGOs in the country that actually have a major goal of reducing malnutrition. And with the recent action of Trump to reduce funding, actually, or to stop funding for nutrition, we have seen a collapse of many of these civil society organizations. And yet they play a very major role in holding governments accountable and implementing nutrition programs. Most of the nutrition programs have been managed by these organizations. But now with the reduction in the funding, we are seeing most of these programs being handed back to the government. And we also already know how our government is doing in terms of implementation of programs. It's doing very, very poorly. So once the program has been handed back to the government, we are seeing its death actually. So as we go through these lectures, I want you to think within yourself, what do you think you can do? What can I do as an individual in my capacity? How do I get to the level of being a stakeholder, to a level of a policymaker, to the level of an implementer of these programs? And if you're already maybe an employee working with one of these organizations, or maybe even in the government, what do you think you can do to drive better policies, to advocate for better outcomes of nutrition and health? So these CSOs bring global knowledge to local discussions and enhance budgeting processes. However, their dependence on external funding presents challenges, as I've already described. It's a very, very big problem, because we have already seen this manifest. Once the funding has been cut off, the organization stops functioning. But as an organization, what do you think you can do if you're the executive director of that organization? How do you think you can actually lobby for resources without having to depend on external funders? You could set up a business from which the proceeds and the profits go into funding the organizational goals. You could actually invest in agriculture, set up a demonstration farm in which you actually grow very many crops, from which the proceeds can go into development of this organization, and also helping the societies overcome the dependence on aid all the time. When we empower these communities, we do more of nutrition education and health education, sensitize them on how best they can use the little that is available to drive better outcomes. I think we can make more impact than only depending on this external funding, which is actually going to breed a community that is dormant and lazy and only dependent on aid. Multi-sectoral approach. Nutrition is not a standalone project. Nutrition requires multi-sectoral approach. It requires many sectors coming together, working together to achieve the better nutrition outcomes. Because we see that in the situation of malnutrition, we are having a health problem here. These children, or maybe the individual, is usually having a medical condition and is having the nutritional problem as well. So if the underlying medical condition has not been dealt with, there's no way there's going to be better nutrition outcome. And if there is poor nutrition, it's going to actually be hard to achieve better nutrition, right? So this is what we are looking at as the multi-sectoral approach. What are those line ministries that you think can come together to actually drive better nutrition? The agriculture sector, the health sector, the food and security sector. So the WASH, there are so many you can think of. And all these come together and work together to achieve better nutrition. Building local capacity for multidisciplinary problem solving is also very important in achieving this multi-sectoral approach. So what is the economic burden of malnutrition on the healthcare system? Malnutrition, we have seen that increases the frequency and severity of illnesses. And once there is more illness and disease in the community, there's going to be a requirement for more medical resources. There's going to be increased hospital admissions and increased need for medication. And according to a report by the World Food Programme in 2019, malnutrition reduces South Sudan's gross domestic production by 16.5% annually. And this is equivalent to 1.7 billion. Just imagine that margin. Look at all these resources that is being channeled into health and nutrition. Which resources could have been used to develop the country in other sectors such as agriculture and industrialization? And this is due to the direct and indirect effects of malnutrition on health, education, on productivity, and also social development. Malnutrition increases the risk of mortality, morbidity, the disability, and also the chronic diseases, which eventually reduce the quality of life and the labor force of the population. So this is a very, very big burden of malnutrition on the healthcare system that is actually very practical to our context. Malnutrition has a substantial financial impact on healthcare systems globally, not only on South Sudan. Many countries all over the world have the same challenge. These costs that include direct medical costs and hospitalization, outpatient care, all of these expenses that are taken into diagnostic testing, the surgeries, long-term care for these individuals affected by malnutrition. For example, in terms of overnutrition, we are having a lot of medications being bought to manage diabetes, heart disease, and also nutritional deficiencies in the undernutrition. We see a child being admitted into a SAM program, and this child is actually staying for over a year in the program. Look at the resources that one single child is actually using. And even after this 1 year of hospitalization, this child goes back home, and after 2 to 3 months, they are back to the hospital with the same problem. We are actually not solving the problem. So what do you think can be done to actually mitigate these challenges of malnutrition? The poor program implementation that we are seeing, or the poor methods of policy making and policy implementation that we manifest in our country. On the human capital, we already said that malnutrition impairs the development of human capital, and this starts from childhood. When the child has not achieved good nutrition in the critical early years of life, this is going to lead to retarded growth, poor cognitive development, and also learning disabilities. These children who experience this malnutrition are also less likely to reach their full potential in terms of the physical, cognitive, and emotional development. And these are the same children that are going to grow up and take up positions in our government and in also the private sector. So what kind of decisions do you think they will make? Of course, they're going to come up with poor decisions and poor policies, and they're not going to have the capacity to implement this. Long-term consequences on education and workforce. Malnourished children will often struggle academically because we have seen that they have poor cognitive development. They will experience absenteeism because a hungry child is a sad child. A child that is hungry cannot actually study well, and is going to have reduced concentration in class. So as these children grow up into adults, they will face limited job opportunities. Why? Because many of them could not actually go far with the education. Some of them will drop out even before they finish primary 8. Yeah. And those that manage to go up to senior 4, they still come out and they have not gotten much. They are going with a push. We are having this mentality of matured, They are coping for these children instead of making them to perform well, instead of giving them food so that they are able to study well. So as these children also grow, they are going to have lower earning potential, and they have reduced ability to contribute to the workforce of the nation. We are seeing an increased rate of unemployment in our country. A lot of youth, some have invested heavily on education, but they're not seeing the jobs, and they're giving up. And a lot of depression is coming up. And this depression comes with more challenges. And still it is going to require the country to invest more resources to actually help these youth come out of depression. And some of them are going to result into robbery and theft. And we are going to see more problems in the country. So if malnutrition is not managed, a country cannot actually grow. Broader economic impact on the society. The impacts of malnutrition extend beyond healthcare and education and affect the society at large. It exacerbates the social inequalities by limiting opportunities for those that are affected. And the population that is grappling with malnutrition is less productive, which hinders overall economic growth and development. The reduced productivity stemming from malnutrition-related health issues impacts businesses and economies. The malnourished children are also more susceptible to illnesses, as we've seen, and this can lead to increased absenteeism and decreased on-the-job productivity. Businesses will face higher healthcare costs for their employees and decreased competitiveness in the global market. So, from these challenges that we have seen, from this far-reaching impact, we now come to realizing the importance of investing in addressing of malnutrition. We have seen that a country that is having poor nutrition cannot actually have productivity. So investing in addressing malnutrition is both a moral imperative and an economic necessity. By preventing malnutrition through nutrition programs, increasing access to healthcare, increasing access to education, you find that societies can cultivate healthier and more productive populations. And these benefits include overall improved healthcare. We're having more skilled and educated workforce, reduce long-term economic and healthcare costs, and economically, for every $1 invested in nutrition interventions, we are seeing a return of $16 in terms of increased productivity, reduced healthcare expenses, and enhanced economic development. So this is where it's very, very important for us to invest in addressing malnutrition. So, and what is the role of the government in ensuring better healthcare and nutrition? One, it's important to license healthcare professionals. Currently, I have seen a trend that is really, really very negative in our country. I'm seeing a lot of young people dying, deaths that could have been prevented. And most of these deaths are happening in our government hospitals. In many clinics, most of the clinics we have in our country are not licensed. We're having a lot of healthcare professionals, people who call themselves healthcare professionals, yet they do not have proper licensing. They have not actually had proper education. They don't even have certificates, some of them. Some of them are in those positions because of connections. Because I know this guy, let me connect him to this job. He needs it. He comes, they give him some basics on how to dispense drugs and how to inject, how to do this and that. They start practicing. What is the result? You find patients coming in and the person is panicking. They don't know, they don't have much knowledge on how to treat this condition, but they still force themselves to actually treat the patient. We shall see a lot of cases of overdosage. This is going to lead to death. Poor drug dispensation. You find that wrong diagnosis is being given. So the government has a role to play in making sure that the people who are actually having education or providing education are licensed, and they provide high quality education, and they produce graduates that are going to be competent in the job market, graduates that are going to be able to provide quality healthcare services. The government has a role to play in influencing the healthcare market. Subsidizing goods, reducing taxes on these goods can help the communities access better food, can help them to afford more of these food items. Provision of health insurance. This is also a role of the government in healthcare. Health research, investing in health research in order to find out what are these major diseases of concern in our country. What are these major nutritional problems of concern in the country, and how are we to overcome them? funding and taxation. This is all a role the government has to play, and even more. You can think of more. So, looking at all these aspects that we have tried to navigate today, we realize that, in summary, the double burden of malnutrition is a major problem in most of our underdeveloped countries, and it comes with a lot of economic drivers that we have seen, such as the poverty, the poor access to food and nutritious food, poor healthcare, poor policies in the government, a lot of things driving this malnutrition. And we also see the impact of the malnutrition on the populace, far-reaching, from the impact on the young children, on the adult community, on the elderly, on the economy, resource allocation. And we see the importance of investing in nutrition. We have also said that for every $1 invested in a nutrition program or in nutrition intervention, we are seeing a return of $16, which is huge. So how about we invest more in nutrition so that we are able to return more? You know? So as we wrap up this session, I would like you all to go on and think, as an individual, as a nutritionist, as a health professional, what can be done in order to see more investment in nutrition in terms of public health nutrition, preventing this malnutrition in the communities? What can be done and how can it be done? These are questions I would like each one of us to ponder on, and I would like to stop